I'm Andrew Pruitt. I'm one of the cardiothoracic surgeons at Trinity Health in Ann Arbor. You know, I've been very lucky and very blessed. When I started surgery as a rotation, it just clicked immediately. And then the first heart operation I saw, I knew this is what I was going to do the rest of my life. It was that simple for me.
My name is Melanie Klink, and I'm a nurse practitioner. I'm retired. I worked as a nurse practitioner in pediatrics for 40 years. I've always been a pretty active person. I've always been into nutrition and health. And I noticed that when I was going upstairs, I was short of breath. And when my husband and I walked, there's a really steep hill. And I was at the point where it's just like, I'll meet you at the top of the hill, honey, because it was just getting kind of hard because I was out of breath.
Melanie had a mitral valve issue. Her mitral valve leaked. Mitral valves have two jobs. All of your heart valves have two jobs. They need to open and let blood through, and then they need to close so the blood doesn't go back where it just came from. That makes the heart efficient. As you know, if your valve leaks, it takes years off your life. Your life expectancy is not the same if you have a leaking valve than if you have one that's functional. So if we can repair that valve and restore its function back to normal, your life expectancy actually returns to normal.
Every place I went, I would always talk to the nurses. Which doctors do you like? You know, who do you think I should have? And everybody said, oh, you have to have Dr. Pruitt. Dr. Pruitt's the best. Dr. Pruitt's the best. Everybody said, you'll love him. He's great. You know, he'll do a great job for you.
Most heart surgery in America, most heart surgery around the world is done through what's called a sternotomy, an incision right down the middle of your chest. It's the best access to your heart. We can do every operation that your heart needs through that incision. However, it's not without morbidity. The recovery from that incision alone is at least 2 months, if not a little bit longer. So alternatively, a company called Intuitive makes the robot. And the robot consists of 4 arms that we use, and it basically allows you to make small incisions and essentially they'll have your hands at the point of where the work needs to be done. People find themselves recovered much more quickly than they would have if we'd have done a sternotomy, and that is one of the biggest appeals of this operation.
So when I heard that he did the robotic procedure, I was interested. And when I went to see him the first time, they gave me a large booklet all about it, so I read everything about it. I was there in the office, and he spent about an hour and a half with us. And first of all, I was a new patient, and that just doesn't happen everywhere. The week before my surgery, I kind of sat on the couch thinking, wow, I could actually die. And it really made me reflect, like, what's actually important. So, of course, I talked to all the people that I love. That was really important to me. First I worried, and then I bonded with my people.
Almost all of my patients who are facing heart surgery are typically facing the most difficult thing they're going to in their life. So you need to remember that when you're talking to people and put yourself in their shoes. You know, my mother used to tell me that, and she's right. You know, how would they see this? I think honesty is one of the better policies. I tell people right off the bat, I said, listen, it's going to be hard, but you're going to be okay. And I'm pretty sure that's what I would have told Melanie. And that absolutely reassure people like Melanie, you absolutely have it in you to get through this. And it's necessary for you to live the life that you really have expected up to this point.
So my first day out of surgery, I opened my eyes and Dr. Pruitt was there. So he gave me this pillow, and he circled this one area where my mitral valve is, and he autographed it and dated it. And he said, valve is repaired, which was really great. Now I can do everything that I want to do again. You know, I'm riding my bike again and walking, and I never liked winter. I'm just not a winter person, but I bought snowshoes last year, so I'm looking forward to going snowshoeing again.
The best part of my job is seeing people through their operation and impacting their life in a positive way. And when you see them back after a month, almost every single time you can tell, you can see it on their face that they're going to be better, that they're better than they were before we started. People look at me, and I try to make this clear too up front. I said, you know, I'm not a doctor, and they have this quick, what do you mean? I said, I'm a plumber. I lay pipes and I fix valves, and that's about what I do.